Good afternoon, everybody. Um, Welcome to the Manchester branch webinar for this afternoon. We have Bob Cummins presenting, and the title is Behavioural Science and COVID-19, How to Create an Environment that Supports the Behaviours Required to Flatten the Curve. So Bob is the CEO and founder of SODAC Limited, whose goal is to challenge and improve much of the current entrenched thinking about how we live, work, lead and manage. Bob has been studying and applying behavioural science since 2007, learning directly from some of the leading professors in behavioural science in the US. Bob is a graduate of Portsmouth University, where he gained a PGC in health and safety. He's also an advisor to the Cambridge Centre for Behavioural Studies in the USA and has over 25 years experience within the private and public sectors. Over to you, Bob.
Thanks, Melissa, and thanks everybody for tuning in. So behavioural science and COVID-19. This is a hot topic, obviously, because of what's going on just now. And behavioural science definitely has a place in helping us both flatten the curve and get back to work. So I'm going to take you through some of the more pertinent points that I think are relevant to this subject, and looking forward to your feedback and questions. Just in addition to Melissa's introduction there, my background before health and safety was engineering, site engineer in construction, and that is, I guess, that gave me my grounding for what I now do in health and safety and behavioural science. And the safety kind of actually came by accident, pardon the pun, when I was working for a company many moons ago, when there was this advert put out for people to join the safety department, and wasn't really sure what I wanted to do with, or whether I wanted to go into kind of safety management, site management, and be an agent, and all the stress that went out with that. Really loved visiting sites and construction, and decided to throw my hat into the safety realm, and loved it. Loved the difference you could make if you really approach this from a practical standpoint. So this has kind of been my mantra, if you like, from the start, is health and safety, and keep it practical with my background in engineering. And that definitely helped in the behavioural science element as well. So now, in 2013, set up a company called SODAC after leaving the corporate world. Last big job was a very successful project in Edinburgh, the Edinburgh Tram project. It wasn't successful. It's successful as in there's a tram now, but one of the probably a great job to actually then jump and set up my own business, because it was a fantastic place to learn about behaviours and how the environment drives behaviour, of which we shall get on to some more about that later on. So back in 2013, and we help companies apply behavioural science to whatever they want, whether that's health, safety, quality, security as well, leadership. It really is applicable, and I've got a wee chat just about the differences between behavioural science, because I think it's worth making a point of as well. Just before we go into the main talk, a wee story for you that kind of helps to set the light of how the environment drives behaviour. So hopefully you can see that there, my sketchy drawing of a lavatory. That's a toilet and sinks in a lavatory. Now this scene is set in a girls' school or a girls' lavatory. It doesn't have to be a girls' school, but this is definitely the girls' lavatory. And these girls are prone to putting on their new lipstick and plonking their lips on the mirror, much to the delight of the girls, but much to the disgust of the poor janitor, who has to clean this mirror off, and every day finds it really difficult to, if you've ever tried to get lipstick off anything, it's quite a chore. He's getting more and more frustrated with the girls' behaviour, cleaning every day. So he sticks up a sign, please don't kiss the mirror. And he takes it even further, and he says, look, guys, if you continue to do this, there will be some disciplinary action taken against you. And the girls continue to do it. They continue to kiss the mirror. Now, the head teacher, who's known for her alternative approach to stuff, says, well, I think I've got an answer to this problem here, what we can do. So she asked the girls to come in to the toilet, to the lavatory, and she said, girls, look, you know, this really isn't on, and I want you to see how difficult it is for us to actually get this lipstick off the mirror here. So we're going to do a demonstration, and the janitor is going to show you exactly how he cleans the mirror and how difficult this is to get off. So he then promptly enters the cubicles and dips the sponge in the toilet bowl, and then proceeds and cleans the mirror with the sponge that's now been dipped in toilet water. Of course, the girls stop kissing the mirror. There's no need for any signage or further interventions, and everybody is happy. This is whether it's true or not, but it's a fantastic story about how if you change the environment, change the contingencies within the environment, you change the behaviour of people. And this really is the theme of any behavioural change, of which we don't really appreciate, of which I didn't appreciate until I learned behavioural science. That, you know, telling is just not enough. And actually don't even direct your efforts maybe towards the individual as such. You direct your efforts towards the environment in which that individual is in, and then the behaviour will change, because it's the environment in which the behaviour is being supported. So that's the kind of main story out of that one. A bit of background or discussion around the difference between behavioural science versus behavioural safety. Now, but one of the reasons we get a lot of work in SODAC is because, well, one, my background in safety, and two, our company's got the word behaviour in it. But behavioural safety and behavioural science are different things. And they're different things also across the globe. So there's a few things I've listed here that I think are worth pointing out. Some of you might know stuff about this already, but behaviour-based safety is something that is prominent in the US and actually Italy, very prominent in Italy as well. And it's an observational-based program. So there's a strict regime of peer-to-peer observation, very formal observation of observing work being done and then issuing feedback, peer-to-peer feedback on that performer to get a change in behavior. And it's relatively successful in altering behavior because the behavior is being observed, and the behavior then alters because it is being observed. But there are some downsides with this, is because once you stop observing, of course, then, and giving that feedback, then the behavior can turn back to what it was before, because you've not actually changed anything other than stick an observer in. Safety differently, which some of you have probably heard about as well, originated mostly in Australia. That's more of a philosophy, I feel, although it's also based human factors, system thinking, HOP, human organizational performance. It's trust-based. Main chap around there, if you want to read a bit more, is a chap called Sidney Dekker. And it's, do you know what, I don't really subscribe to the safety 1, safety 2 kind of differences as such. There just was good ways of getting people to do safe things and not so good ways of getting people to do safe things. There's a bit of science in there, but not much. Behavioural safety in the UK is mostly, for the most of it, not science-based at all, which is a real shame. Although there's a few more companies like Costain have got an accredited program now, and some other companies are using behavioural science in there as well. But mostly it's sheep dip, kind of reprogramming the worker-based approach. And apologies if that slightly annoys anybody, but it's kind of what it is at the minute. But there is more behavioural science getting in there. Nudge theory, behavioural economics are similar. Nudge theory is like that high-level libertarian paternalism, trying to affect behavioural change while giving people freedom of choice. So nudging people towards the kind of right decisions at a governmental policy level, if you like. So examples are making it the kind of default option to donate organs rather than actually opting in to donate organs. So changing the kind of default settings around those kind of things. Behavioural economics, some of the greatest thinkers at the minute, present, Kahneman and Thaler, who got the Nobel Prize rather, and Dan Ariely, if you haven't followed him, worth a look as well. But very much based on kind of biases, system one, system two thinking. And then you've got Skinner, which is the main chap behind behavioural science, which is applied at a local level. This is the kind of way I like to think about behavioural science, although you'll get a different, sometimes a different Googling of that if you search it, different explanation. But behavioural science in its kind of applied sense is understanding that behaviours are driven by the local environment and then targeting the local environment for specific change, something that nudge doesn't really do, or some of the behavioural economic stuff. That is what we're going to talk about today, is the applied aspect of behavioural science. But it is just worth noticing these changes, but by all means kind of read up on these as well. None of them are well, you know, actually, yes, a lot of the behavioural safety stuff in the UK isn't as good as it could be yet. Anyway, right, on with today. So today, yes, how to create environments that support the behaviours required to flatten the curve. But actually, you know, let's more direct this to returning to work, because that's where the risk is at the moment. You know, hopefully we've done our bit by staying behind closed doors, but now it's the kind of anxious next phase element of returning to work. And that's where the real application of behavioural science can make a difference in helping shape these behaviours. And more of the behaviours that you want rather than those that you don't. What this is not going to be is, it's not health advice, okay? Obviously, I'm not a health professional, as in the things around the COVID stuff, right? So we're not getting to get a debate whether face masks are good or not good to wear, those kind of things. Yeah, I'm not going to offer an opinion of whether I think they are or aren't, because that's not my area of expertise. What this is, though, is this is going to be suggestions and examples of how behavioural science can help to encourage the required behaviours needed to return to work safely during the pandemic. Okay, so very much about this philosophy of the environment drives behaviour, and we're going to delve into that. Okay, I've split this up into 5 main elements that I'm going to talk around. So behaviour, obviously. Setting expectations, which is very, very important. And this is usually often where we stop, actually, is we often stop with the setting of expectations, and sometimes we don't do a very good job of that either. You just have to look at some of the governmental stuff that's happened there. We don't then follow on to the next bits, which are critical, which is the environment, the differences in people, different people, and also behaviour change at this local level as well. Okay, that is massively critical, the behaviour change at local level. So those are the parts we're going to talk about and rattle through, and hopefully get some questions. Right, behaviour. Okay, so a few things to get straight about behaviour. A behaviour is what we say and do. Okay, that's the easiest way to think about a behaviour and what it is. And every single behaviour that happens can be measured. This is a science, so you have to boil it down into what you can measure. So every single behaviour, you get to a point where you define it effectively, and it actually can be measured. And no behaviour happens in isolation on its own or by itself. There is nothing that we do that is just pops out of nowhere. Everything is connected to other things around it. And that is vitally important when understanding what is making someone do what they're doing at the moment. And also then how to then change what they're doing, is understanding that there's stuff around either side of the behaviour that's happening. And that's what we have to target in order to get the behaviour to change. So every behaviour is linked to the environment it occurs in at the time it occurs. Okay, every single behaviour is fundamentally a response to the actual place that person was in at that time. Again, massively important. And although it might sound simple, and it is, that simplicity is part of the complexity around the problem, because we are so much in it that we don't see it, as it were. And I'd just like you to kind of hold this point as well, that every behaviour that you see happening is perfectly designed to happen. So the ones that you're happy with, that's great. But the ones that you're not happy with as well, they're perfectly designed to happen at that moment in time. Everything that led up to that point, before that point, when the person got to that point, that was going to be the reaction that they did at that time. And that is quite a difficult one to hold when something is going wrong, or perhaps you don't like what you're seeing in front of you as well. If a behavior happens, this is how the individual interpreted the environment. Okay, so the clue to what your environment is supporting is the actual output of the person's behavior. Okay. Now, the best way, right, to think about behavior, so I've said it's behavior is what you say and do, but really actually what I want you to think about is behavior as an action. Okay, so think about a behavior, someone doing something as an action. They're actually physically doing something, whether it's laying a brick, whether it's laying the mortar, whether it's holding the trowel, whether it's putting a glove on. That is the actual behavior. Behaviors aren't attitudes and they're not beliefs. They are in behavioral science, they are physical things that the person or entity does, right? The person does, the behavior. And this is why we can measure them. We can measure how many times a person lays a brick. We can measure how many times someone says hello. So there's verbal behaviors and there's physical behaviors. We can measure how many times I click the button to advance the slides on the screen. You could probably have a guess about that by how many times things change, and then have a guess about how many times I click the button. But every click of the button is a behavior. Okay, so in behavioral science, there is no judgment around behaviors because they are just products of the environment in which the person was in. They are an action. Okay. But we tend not to be specific, and this causes problems when we're communicating because we don't actually talk in behavioral terms, if you like. We don't talk specifically about specific behaviors. We talk in a kind of labeled way. So things like wash your hands regularly, wipe down surfaces often, social distance, stay alert, isolate. If you feel unwell, tell us, come to work if you need to. These are not behaviors, right? They are too vague, too open to interpretation. They're not specific enough to be able to be measured. There is not enough setting of clear expectation of measurable substance within these. So look out for this when you're actually explaining what you want in the areas that you want it. You have to be really, really specific to the point of no misinterpretation about what the actual behavior is that you want to see. That obviously helps with communication, but what it definitely helps with is measurement and then feedback of, well, this is the amount of times I saw you doing what we asked of you, and this is the amount of times I saw you doing something different from that, right, which was a different behavior. So pinpointed behaviors, some examples of those. Linked to those other ones that we saw. So stay 2 or more meters apart is far more pinpointed than the word social distance. Wear a face mask when in shops or offices, whether that's right or wrong, is far more pinpointed a behavior and one that you could measure. Keep your hands away from your face. If you feel ill with these symptoms, tell Mike. So make it specific to the areas that you're in. Obviously symptoms, you have to make that specific as well. Wash your hands before every meal, wash your hands before getting in your car. Very, very clear expectations. Simon, come to the office Monday, Tuesday and Wednesday. Very, very clear expectations of which you can then measure every single one of this. So the first place to start when you're looking to use behavioral science to help get more of the behaviors you want, you need to specify the behaviors that you want as well. But these might be different in different locations. So they're not going to be the same in every single location. Obviously, Mike's not going to be in every location and Simon's not going to be in every location. So at some point, you have to drill it right down into the specific areas to make these pinpointed behaviors specific to the individuals and the group of individuals, which of course is where one of the first barriers comes up with. It's going to take time to make every area specific with specifically pinpointed requests. So setting expectations. So once you've, if you like, determined what your pinpointed behaviours are going to be in the areas that you want them, the local areas, then you have to look at setting some expectations to people. So if you're in charge, or if you're assisting your company in devising a get back to work plan, then it's not going to be the same for every area. It's not going to be the same on sites that it is for or in the offices. So these pinpointed behaviours are going to be different. Yeah, so they're going to be different for each area. Then once you've devised these, you need to tell someone. So you need to set the expectation literally of what is expected of people in these pinpointed specific ways. There's a number of reasons, the benefits of doing this. You want to decide that there's so much stuff out there, right? Okay, there's some good guidance, and there's a lot of conjecture around some of that guidance as well. But the best thing to do, and this is definitely my opinion, I'm going to say now, is stick to the governmental advice, right? HSE advice, the whatever body your industry happens to be associated with, and sticking to that, and not starting to kind of make opinions of whether plexiglass is good or not making opinions of whether masks are good or not. It's like, what does it say with in your industry that it should be the bare minimum, if you like, and then that's your baseline, okay? And set that expectation to everybody in order to create certainty. So we'll touch on this in a minute, but everybody is coming back to work from different areas, different households, different peer groups. They all have different opinions, of slightly different opinions of what's right or wrong. It's your role, if you like, back in the workplace to help create some certainty by, no, this is what we do here, right? You can do something else at home if you want, but this is what we do here when we're at work here. Because it can seem overwhelming, right, for you and others. So creating certainty actually relieves stress in you once you've actually decided what your risk assessment and what your processes and behaviors are going to be. Then they're decided. Yeah, it's stress relief, right? You've done that bit. By all means, well, you have to go back and make sure they were right, because you might have to adjust them. But there's stress relief there, and it's stress relief for others as well. It's once they have been told unambiguously what is expected of them. People will be anxious about return to work, obviously, right? Various levels of anxiety within the workplace as well. So again, the clarity around unambiguous stuff is massively clear. I mean, the thing about stay alert, it's ridiculous. We're not going to get into that, the politics around this, but stay alert is just meaningless statement. You want to be hard, concrete expectations disseminated to your people. Because your people will be looking for that certainty. So provide clear and unambiguous expectations, and that will massively help. And don't assume people have read, don't just send stuff out. Don't just stick stuff up on posters. There's going to be a lot of consultation needed, a lot of, briefing and taking people aside and sitting down with them and making sure that they're clear. And actually that then follows onto this, that it's, you have to be specific and demonstrate. I would suggest you demonstrate what is required. So demonstrate like what it's like to wash hands for 20 seconds and how you do them. Yeah. Don't assume that people have been doing it right since they've been at home. And also there's this thing also called behavioural creep, where behaviours will have morphed into something else and people won't have even realised. So they may have been good at 20 seconds to start with, and now it's down to 10, 15, whatever. So demonstrate things, demonstrate what it's like to wear a face mask. We've all seen examples of those that haven't been quite right. Demonstrate what 2 meters is apart. Demonstrate about the points you want cleaned. This is an example of stickers that we've got that we're sticking around on points that we want the cleaners to clean more often than not, and also to people to be aware of as cross-contamination points. And this is an example I just nabbed off the internet of, you can see by the orientation of the feet here, this is a lift. So the expectation in this lift, and I don't know how good this would be for preventing the spread, but it would be quite funny to see, if nothing else, of everybody facing corners in a lift when you get in. Yeah, I think that'd be quite entertaining. But making the specific again statement and unambiguous and demonstrating this lift is for X amount of people, how many of it is. This kitchen can only hold 2 people, so in this kitchen we're only having 2 folk at a time. this stair is down only and this other one is up only if you've got that luxury sort of thing. This point came up, you know, we've been on to folk for ages to hold the handrail. Regardless of what you think about that, I've got some of my own opinions about that. But if you are a company that's been pushing the holding the handrail thing, well, you know, why would you want to hold the handrail if it's everybody else is holding the handrail? So you're going to have to increase the cleaning regime around that handrail, and tell everybody you're doing that if you want them to still hold the handrail. And then you'll have to tell the cleaner as well what your expectation is around cleaning that handrail too. But the point here is it's being specific. So it's taking this, removing assumptions, any assumptions about what you required. And this really is the first and grounding point in using behavioral science, is to name things that can be measured, right? All of this stuff can be measured. You could then see how many people were getting the lift. Oh, look, this, most of the time it's 4, actually most of the time it's 3, sometimes it's 5. It's the kitchen, you know, what is the compliance level? So once you've got it against this benchmark, you can then start to measure it. And, you know, don't assume that people know what you have briefed. There's this great thing in communication with humans, is we've got an idea in our head about exactly what we mean because we visualize stuff in pictures. We then turn that into words, and we then tell these words to other people, and we expect for some magic reason that they'll have the same picture in their head as us. And that rarely happens, because the picture that they have in their head is, yes, triggered by the words that we say, but the pictures they have are from their experiences and their interpretation, not ours, right? So you really have no way of knowing what that person actually thinks they've heard or interpreted until you see them do it, okay? And I don't know if you've seen, this was quite a funny one that went around social media, wear a face mask on public transport. So, well, what kind of face mask did you mean? Well, I never thought I would have to explain it. Well, yes, you maybe did. So don't, you know, never assume, as they say, but this, make it as pinpointed as possible. Photos, pictures, demonstrate it. Another good way actually is, once you have some of the people in your office and sites back, I would suggest taking pictures of them doing the correct behaviours and using them as the examples to show other people about what's expected. Don't use actors, don't use stock images, use the real people who are there on those sites. You're involving them. They've got a social contract then with you of standing in front of a camera. It's all around them, and if they start to do something different, it would feel awkward to them. Hopefully, most of them anyway. So yeah, some points there. By the way, there'll be a PDF of these slides. I'm sure we can get that to you somehow. So there's lots of stuff on here. So if you're scrabbling to make notes, because I've got tons to get through, but there'll be a PDF sent out. Okay, so we've covered behaviour, the clarity of expectation, but I did mention at the start this important part about the environment, and that's what I want to talk about next, is this environment. And the environment, to me, with my experience now in behavioural science, probably means a fair bit different to me than it does to you. And so I really need to try my best to get this next point, or these next points, across to you, to get close to what I think about the environment. So let's give that a go. So the environment is where it all happens, okay? So where every behavior happens. So the environment, think of the environment as local to the performer, local to you. So wherever you are just now, just have a quick look around, and that is your environment. Now you must have some device in front of you to be watching this. So that is part of the environment. So you've got the physical setting. Now, if someone were to come into the room where you were, then that would be a different impingement on the environment. So there would be another thing in the environment come into the room, and any of one of those things can start to alter your behavior. But the environment is local to you, and it is where all the stuff that makes behavior happens comes out. But it's really physical, right? So the environment is massively physical and real, if you like, okay? So I'm not talking about the kind of, oh, the environment or the system or anything like that, right? I'm talking about the actual physical things in front of you at this moment in time. That if somebody kind of comes in and says, do you want a cup of coffee? Your reaction will either be yes or get out because I'm listening to a webinar, right? That kind of thing. They will drive a new behavior in you if they start to kind of encroach in your environment. So the environment is the physical stuff and the other people, right, in the environment. And it is local to the performer, and it changes, of course. So as you move around into different environments from your home and then start to go back to the office or the site, then the office and the site will then become the environment that you're in, and your car in between that and wherever else. And you're constantly playing off the environment in front of you. So the environment is unique in each case to each person, right? But it also changes with different people. So you can have the same physical setting, and well, imagine that you're sitting down at dinner with your family, and there's 4 of you or whatever, everybody, mum, dad, kids, right, having a meal, and there's certain behaviors happen because all 4 or 5 of you are there, right? Take the kids away, and it's just you and your other half, and there's a different set of behaviors happen because you haven't got these other things happening to you that are making you do stuff, okay? So although the physical setting was the same, because of the different people in the environment, then that environment changes. So the environment really is this kind of different place with different people inside it as well. But it provides the stimulus and reinforcement for behaviors to happen. So for these pinpointed behaviors that we talked about at the start, it's the local environment that provides the stimulus and reinforcement for these behaviors. And this is massively, massively important. And we'll touch on this in a second. So think of the person as the receiver of stimulus, if you like. So you're constantly receiving signals from the environment around you. And these signals are then what prompts the stuff that you do, your actions. And there's a good set of these things are not actually even purposeful, they're automatic. They're reactions to stimulus without you fully being conscious around it. Some of these are closer to consciousness than others. So some are built up over many, many years of experience of habitual responses, but they have moved into this kind of second section of the brain, if you like, that Kahneman would talk about, which is just metaphorical, of being in the automatic fluency area, if you like. So you don't have to learn to walk or talk anymore. You don't have to concentrate to do that. It just comes naturally. You don't have to concentrate to drive a car if you've driven it for many years. It just comes naturally. And a lot of these reactions that happen in this element or area of the brain are automatic and before you're even consciously aware of them. But these can also be things like snapping at people, getting annoyed at folk and then saying something you didn't really want to say, but it came out and like, damn, that's now out there and I wish I hadn't said it. But anyway, every single behavior is in response to the environment in which the performer is in, okay? So behavior just doesn't happen in isolation. It happens because of the stuff around us. So if you want to change the behavior of someone, you have to change the stuff around them, right, in order to get a different reaction out of them. We're massively habitual in our behaviors, and once we learn a pattern, we tend to stick to it. So the majority of behaviors are learned. They're not innate. They're not down to your personality and things like that. The majority of behaviors are learned through exposure to the environment. So the amount of years you spent on this planet then gives you this behavioral repertoire of how you respond to certain things. So whether you like, which type of coffee you like is even learned. It's not an innate preference. And if we exposed you to enough of a coffee that you didn't like, you would begin to like that coffee. Nobody liked, well, very few people liked alcohol straight off the bat. We had to learn to like alcohol, which is kind of weird that we had to learn to like a poison, but again, that's a completely different webinar again. But behaviors are learned, right? The behaviours that people exhibit merely represent their interpretation of the physical and social environment that they see in front of them, right? So the behaviours that they exhibit is an insight into their past experiences linked to the current environment. The interpretation, so this interpretation comes from past experiences of this or similar environments as well. And if you want to do something different, you simply want them to learn to interpret this new environment differently. So you want to create a new learning history for this person, right? So the key to behavioral changes is also exposure to new experiences, new stimulus, new reinforcement that will then become your back catalogue of experiences, if you like. So you have to create new experiences. We'll talk briefly about that. In order to, so you need to create new experiences that will become their past experiences that will in turn inform how they see the present, right? That might sound a bit of a head twist, right? But so I'll repeat that. So you need to create new experiences that will become their past experiences that will in turn inform how they see the present, right? You're literally trying to reprogram people so that they actually have this new set of experiences that inform how they behave in the present. Very simply, they just have to learn a new pattern of behavior appropriate to the new norm, right? That is oversimplifying it, but that's kind of what we're trying to get to. So again, back to this adjustment of behavior. So although it's important to obviously, well, it was said at the start and the way I started on this, pinpoint the behaviors that are required to set the expectations, don't expect just by briefing those that they will actually happen, because they won't. And we've seen this with governmental guidance and everything of, you know, they tried to tell us what to do and certain people did it, certain people didn't. And that's because nothing changed in the environments of those that didn't, if you like. So really what you want to do is take that to the next step and adjust the environment around the individual, okay? So back to, there's two components to the environment. There's physical prompts, the physical part of the environment. So this is things like signage, markings, stickers, adjusting the layout, make it look different. If people come back to work and everything looks the same, their behavior will calibrate to what it was before when they were there before, right? Massively quickly. They will just go back into automatic mode because that's what the environment supports. So make it look different, right? Adjust the layout, stick on stuff, put markings down. Again, don't expect that to do the trick though, because the next part is massively important as well, which is the social prompts in the environment. So that's things from other people. So it's feedback, it's conversations, it's challenges around behaviors that are not quite correct, it's acknowledgement of the behaviors that are correct. But you change the environment to change the behavior in the person, okay? That's the biggest thing out of all this talk is change the environment to change the behavior. But it has to be at the local level. It has to be at each office, at each site, at each canteen, right? If you've got a site with multiple canteens, you have to do each canteen. You have to do it specifically for where the people are going to come back to work. And there's different people, right? So if you think about, we've been in lockdown now for however many months it is. And for many people that haven't been at work, they've been in their own house. They've been creating their own behavioural repertoire of what their interpretation was of the governmental guidance. They've not had the ability to share much or be given feedback around whether their behaviours were correct or not, perhaps. So in their mind, everybody thinks that what they do is the right thing. And most people will have a story that's unique to them, and they'll be coming back to work with their story of what is unique to them in their heads. But most people obviously want to do a good job, respond to instruction and feedback at this local level. They'll want some sort of acknowledgement from the supervisor, and they'll want to do the same as their peers. And they don't want to catch COVID-19, the majority of people, okay? So we've already got this on our side, and it's utilizing these points and making the most out of them that can really help us with this different element. But it really is recognizing that the people that are coming back have come from different backgrounds, right? For the last 2 months or 2 and a bit months, from different experiences that they've had, all learned. So their current learning history around how to react in a pandemic is all home-based, right? Or those that were work, it's at work without many people around, rather than actually work with more people around. So there's this 2.5 months of learned experience so far that with some might be great and with others might not be what you were after, all coming to work. So a blanket approach won't work, right? So this is why you can't just create a policy at a high level and expect it to change behaviours at a local level, because we've got so many of these variables. The environment looks different. The people coming back into that environment are different people with different learning histories. So the plan has to be specific to that specific area. So behaviour change. Well, this is a very simple behaviour change model here, right? Starting at the top, set an expectation, measure, feedback, and reinforce, okay? But this has to be effective, has to be done at a local level. So because you want to change the way each of these individuals see the environment or interpret the environment through these measures. You want to alter the forces that are acting upon them and reshape behavior by adjusting the environment around them and giving them this new learning history, if you like. And you need to look at the spheres of influence at this local level. So the main kind of people, the at-risk people, of which there's obviously most of us are in this category, but there's certain other people that will have more of a supervisory and management role around this. So it would pay to map the influence chain. And what I mean by the influence chain is the person that provides feedback and reinforcement consequence to the individuals that you're wanting to change behavior, and the person that provides feedback to that person, and then the person that provides feedback to that person. And it's different in each location again, right? So you've got a different environment with different influencers in each location that are specific, that you're wanting specific behaviors, specific things to be said and done of a similar nature, but specific because there's specific requirements in each area. So this is a big task, yeah? And this is why it's risky, because the tendency is to just issue a procedure and expect people to read it and follow it. And that just doesn't work. What works is local change to affect the environments in which people are in through acknowledgement and feedback and expectation setting, and all those elements that were covered in that change model before, in order to kind of re-engineer the environment to prompt the correct behaviors that you actually want. Behavior, so this is a bit more detailed behavior change model. So explore what you want to be different. So what does that different look like at the local level? So this is going right back to the start, right, about setting expectations. Well, before you even set expectations, actually, what is it that you're actually expecting things to look like in this new norm? And bearing in mind that you might not even be right about what it looks like. Then setting those expectations to the people that you need to do different behaviors at each local level. Alter the physical environment and the social environment, because if you don't, everything will look the same. If everything looks the same, the behaviors will look the same as well. People have to be saying and doing different things, and the physical environment has to look different in order for the new behaviors to happen, because behaviors are a product of the environment that the people are going back into. But then you've got to observe, because you don't know how your alterations are going to affect the environment. And you don't know how people are going to read the alterations in that environment as well. So the only way you can tell this is by measuring and then feeding back to people, acknowledging what the right behaviors are and reinforcing them and sharing examples of what good looks like. And then adjusting and correcting where necessary. So where you're not getting the behaviors that you want, then correcting them and actually then repeating the whole process from the start. And it's more actually behavioral maintenance rather than actually behavioral change is what we'll be looking at. Last kind of few slides. There's certain types of feedback which are important to look at, I think, when you're trying to change these behaviors. So observational data, you can categorize the types of behaviors that you want, types of behaviors you don't want, monitor them often. Nothing more difficult than a tally sheet, no names, completely anonymous, just gather feedback on how many people are doing the right thing, how many people are doing something that isn't quite right. Publish, involve, share, discuss, Again, it's no judgment. This is just raw data, if you like, on behavioural data, observational data. Technology, we did a webinar where we discussed proximity sensors, which you can access through our website, which I'll give you the details of. Proximity sensors, I'd only be a fan of those if they were voluntary. So if people were actually volunteering to use them, and it was for personal use and team use. And if it was for like company use, it would be on a metadata anonymous scale. So you want to remove any chance that the director can go and lampoon people for doing incorrect, proximity behaviours or incorrect social distancing. Anecdotal types of feedback, check in with people, conversation-based, regular discussions, and feedback and support. Back to the kind of anxiety issues, there's going to be lots of people that are anxious about coming back to work. Speaking more often to people, making sure that they're okay, checking in with them, showing them what you're doing as well, showing them that did you realize, we've actually employed more cleaners than normal. They're actually in a higher regime. You might not have thought to tell them that, but I'd want to know that if I was going back into the office, that stuff was getting clean more often, and it helps with that anxiety as well. Right, just to finish off some important points. People don't do a behavior just because they are told to, even if they intend to do it. And this is because it happens because of the environment. So even though I might agree to do new behavior, if the environment doesn't support that new behavior, it'll not happen. So new behaviors have to be learned. They require prompting and then reinforcing a number of times before they become the norm, right? So expect there to be a level of non-compliance when you introduce your new expectations, because they're new expectations, they're behaviors that have not been happening in this context yet. So there will be a level of non-compliance. Some people might have genuine difficulty exhibiting the new desired behavior. Okay, there will be people that find it really difficult to social distance, find it really difficult to change because their learning experience is so ingrained in them that they find it difficult to do these new behaviors. But with those people, support, nurture, assist, but at some point, you might have to take the decision to say, stay at home. At this point in time, with what you're doing and how you're interpreting the environment, Mr. Smith, we can't have you here for your own benefit and for others. And it's not a ticking off, it's not a disciplinary, it's just facing the facts that some people might not be able to fully comply with the new norm because you haven't got enough resource and allocation of time to be able to recondition them into this new behavior. Just to recap on this, a behavior is what we say and do, so it's an action. So make sure your expectations are pinpointed to a point where every single behavior that you're asking for can be measured. That's a good test of whether it's pinpointed or not. No behavior happens in isolation, on its own, by itself. Every behavior is linked to the environment it occurs in. So the environment is what produces behaviors. So if you want a change in behavior, change the environment around the individual through either the physical prompts or the social prompts, and keep at it until you create this new pattern of behaviors. Because every behavior is perfectly designed to happen. And if a behavior happens, this is how the individual interprets the environment. Okay, that's the main points there. Well, that was it. A very fast, and I realize a lot of information thrown at you there. But as I say, I'll arrange somehow. I'm sure we can get a PDF of these to you. Check out the website sodac.co.uk for the free COVID-19 resources that we've got available as well. A couple other recordings of webinars and a guidance document that we produced as well. And yeah, thank you very much for listening, Melissa, or whoever's there. Back over to you.
Thank you, Bob. Brilliant. As always, it was brilliant. We've had some really good feedback as we've been going as well. I think we've got time for a couple of questions, if you don't mind.
Okay, excellent. Yeah, good.
Okay. So the first one, I look after an aircraft maintenance engineers at London Heathrow Airport. Most of our staff have worked throughout lockdown with little change to their day-to-day routine. Social distancing is difficult to achieve whilst carrying out aircraft maintenance, although measures have been taken to ensure this happens where possible. Staff are accustomed to working in close proximity, therefore implementing behavioural changes in communal areas such as canteens and changing rooms has proven to be quite difficult. What advice would you give to workplaces that have been open and operating throughout lockdown?
Well, so I guess there's a couple of points I'm maybe interpreting from this is so places that have been open and operating now that the rest of us are perhaps coming back to work, or there's these people that have been operating already could have quite a good handle on how to operate safely, and there's going to be these bunch of newbies coming back in to operate as well and disrupting the routine. But I'm not sure if that was fully the question, or if the question was these guys haven't been complying and what do I do? Do you know what? There's every day. So taking that first point, it's a risk if people have already been operating and there's other people now going to come back into this the environment, and that will literally change the conditions and the prompts. So there's a few things you can ask those people that have already been there to help set the expectations, to help explain that the importance of demonstrating the required behaviours to these newbies that are coming in. You know, guys, this is how we do stuff here now, right? You know, the old stuff's gone. This is how we now do stuff, right? So there's a benefit in having folk that have been there already, and then, you know, we don't, you know, when we start in a site, or we don't actually listen to the procedures that we're briefed on. You know, let's be honest. We wait until we get out there and actually see what everybody else is doing. If everybody else is doing the right thing, then we'll just gravitate towards that. Now, if everybody's doing the wrong thing, we'll gravitate to that as well, which is a problem. So if the kind of question is, well, I'm having difficulty getting these guys to comply, and it's now 2.5 months down the line, that's difficult, yes, but the longer you let it go on, the more difficult it'll be. Every change of shift is a disruption in the patterns of behavior, is where you could start afresh, if you like. But you almost have to take it down this agreed zero tolerance kind of route. I don't like kind of the phrase zero tolerance without the kind of caveat of you have to get people to agree to it in the first place. So, right, guys, do you agree that we've not been doing it quite right? We need to change. We need to do, this is what right looks like, right? Let's start from tomorrow, and let's take some of these things into account of how we actually can support each other doing it the right way. So although it's more difficult the longer it's been going on, every time you wake up and get up in the morning and go to work, that's a disruption in the behavioural patterns that you can take advantage of, and start again, if you like, start afresh almost, but difficult, yeah.
Okay, got another one for you.
Mm-hmm.
We're seeing almost a regression in people with the confidence to act with common sense within their own knowledge and experiences. What can we do to encourage that confidence?
Okay, so confidence in acting within their experience. So this, I guess, again, trying to second guess what this means. Does it mean that people aren't as confident in acting in the way that they were before they got to work, or is it specifically COVID related? If it's, I'm now not that as confident as I was before because I've had a 2.5 month break of doing what I'm doing, then yeah, sure, that's probably fair play. I mean, I drove the car for the first time in a month, and it was really weird, sort of thing, especially the amount of cyclists that seem to be on the road. So I think it would be normal to have a lack of confidence around an area of expertise going back to work in this, if that's where the question's coming from. The common sense thing is, you know, there really is no such thing as common sense. There's many people around us, and they've all got a different interpretation of what they see in front of them. And you know, somebody said at some point, whoever it was, could have been Drucker. The problem with common sense is it's not that common. And so whatever you see is down to whatever the environment and that person's interpretation of the environment is at that time. And if we're distracted by other stuff that's going on about, well, who's got the kids? Am I cleaning my hands enough? Did I just touch my face and give myself COVID? You know, there's all these now competing things that we've got to think about that are going to distract us from our activities, and that are there for a reason. it's good to have an element of healthy anxiety around this stuff as well, but it's a distraction. So when I've been asked about kind of how do we combat that in the past, my suggestion is allowing people more time where they can be allowed more time to do stuff, checking in with people to see if they're okay, buddying up with people, and for that person to give permission to the other person that if you see me doing something that looks daft, tell me about it, because there's a chance I might do something that's daft, because I'm not firing on all cylinders, or actually I'm firing on too many cylinders because I've got all this stuff going on in my head as well at this moment in time. So I think compassion and support and nurture around and expecting a lack of confidence, I think, is good.
Thank you. I think we're running out of time now, guys. We've had a lot of really good questions, actually, and Bob, you've agreed to answer the questions separately so we can send them out with the recording and the PDF of the slides.
Yep. So I'll send the PDF to you and then you can send them out, yeah?
Brill.
Excellent.
So just one last thing, guys. Thank you very much, Bob. We've had loads of great feedback as we've been going along. Thank you very much, everybody, for attending, and we hope it was really useful.